Welcome back to Inside South Florida. Hopefully you won't have to visit an emergency medical center anytime soon, but if you do, there are two brand new ones in Broward and they're both freestanding. Here's Dr. Jeff Ingman. Dr. Ingman, welcome to the show. How you doing?
I'm doing great, thank you.
This is a very exciting time in South Florida because there's not one but two of these freestanding emergency medical centers that are set to open. Pretty cool stuff.
Yeah, it is.
So tell us what a freestanding emergency department is.
Basically, it's an extension of an existing emergency department. The way it's established in Florida, they have to be affiliated with a hospital. And these are the first two that are opening in Broward County. And we're excited about it because it gives us an additional 11 hospital ER beds in another location to reach more people. So rather than expanding an ER on an existing campus, then we can reach out into a community and service people faster and more efficiently.
So we've got one opening in Davie and one opening in Coconut Creek, correct?
That's correct.
And
yes.
and the hospital affiliation is?
In Davie, it's Florida Medical Center.
Okay.
And in Coconut Creek, it's West Boca Medical Center.
And in these freestanding centers, what kind of care do you offer?
Anything that a main ER can handle. So we'll take ambulances. We have 24 hours, 7 days a week. We'll be open. We offer, CT scan, all the radiology services that a regular emergency department would offer, laboratory services, ultrasound, and we have the same on-call list of specialists that would be at the main hospital is also on call for the.
So these must be pretty big, these buildings.
Yeah, it's pretty good size. I don't know the exact square footage,
right,
but it has a pretty good footprint.
Yeah. You take insurance, much the same as another hospital would, right?
Yeah, and no appointment necessary.
Right.
Just like an emergency department, you come in. Of course, you're seen based on acuity. These departments tend to see people fairly quickly, though.
So you mentioned, these are the first two in Broward. Is this a fairly new type of care around the country?
It is. Back in probably the mid-2000s, we started seeing freestanding departments open up. A lot of them opened up in Houston. Some entrepreneurial emergency department physicians started to open up their own private facilities. And then it kind of caught on because people realized they can get emergency department level of care in kind of an expeditious, kind of a nicer boutique fashion.
Yeah, that's what I was going to ask you. What would be some of the advantages to go here rather than, a hospital or urgent care clinic or something like that?
Well, urgent care still has its place, and we certainly work with urgent cares. If they see a patient that they think is a little bit out of their realm, they can send it to us. If they have somebody that they feel needs to be admitted to the hospital, for example, they can come to the freestanding. The laboratory and the radiology services are dedicated to that site. So we're not taking care of inpatients there. So the turnaround time for test results is quicker.
That's great because anyone that's ever been admitted for anything knows that the waiting for the test results, that's
right.
Not only does it sort of delay the care, but it's also stressful for the patient. So if you can expedite test results, that's fantastic.
Oh yeah.
Yeah. So why Davie? Why Coconut Creek? Was there a lot of strategy placed in where you were going to put these centers?
I wasn't that involved with the Davie facility. I know they picked an area that had an existing medical complex, and it was easy to move in there, and it was in a good location for a lot of people to access. Where we're located, West Boca being in the southern end of Palm Beach County, put us right on the border, like we're a mile from the county line. And a lot of our patients and clients come from the northern Broward County. So, but ambulance services and stuff like that, because of crossing county lines, sometimes made it a little inconvenient for certain patients to get to us. Mm-hmm. Now we've got a facility there, and it's in a lot of residential communities around there, businesses, and I think will be a good asset for that area.
I know that the ones down here that, as we have this conversation, haven't opened yet or about to open, but from what your research has indicated to you, how do patients typically feel when they go to clinics like this?
Yeah, there's one in Aventura, I believe, that's been open since 2007, And I know the director there quite well, and have exchanged information about what worked for them and how they made it efficient. And it's pretty well received. They got busy within the first few months. They took off, and people really appreciate that type of care and service.
Because I would think, I don't know, you tell me, but I would think if someone needs treatment, the two biggest concerns would be speed and quality of care, right?
Correct.
Like how long do I have to wait, and what will the doctors be like when I do finally get in a room?
Yes.
But on both of those occasions, it sounds like you guys have created a system that seems to be advantageous on both ways.
Yeah, doing the research for this, we found that if you're going to be in a standalone facility, you want experience. You want experienced people. And we've actually got a very experienced team of both emergency trained physicians as well as nurses. So we're not sticking the rookies out there. We
Right.
want to make sure that they know what they're doing.
Always good when the docs know what they're doing.
Sure.
All right, so give us the pertinent information, website, location, whatever you'd like to give.
Sure. The Emergency Care Center of Coconut Creek is located on State Road 7. It's 4890 State Road 7, Coconut Creek, Florida, on 441, just south of the Sawgrass Expressway.
And you mentioned earlier that you anticipate wait times probably will not be that long, right, or shorter than they might be at a conventional ER.
Correct.
Yeah. Well, it sounds great. Best of luck. I'm sure you're quite busy these days, and you'll have to come back on in a few months, and we'll talk some more about it, right?
All right. Thank you very much for having me.
You got it. Thanks
Appreciate
very
it.
much. All right.